For years, there's been this nagging health question that's worried a lot of people, especially older women. Could the calcium supplements we take for our bones actually be bad for our brains? Well, today, we're diving into what looks like a new verdict on that link between calcium and dementia.
I mean, this is really the heart of the matter, isn't it? You're trying to do the right thing, take calcium to keep your bones strong, but what if there's a catch? For a long time, this worry has been lingering, that those same supplements could somehow up your risk for dementia. It's a question that really deserves a clear answer.
And this whole situation sets up what we can call the calcium dilemma. It's that classic problem of trying to do something good for one part of your body without accidentally causing trouble for another. So on one side, you have postmenopausal women who are often told to take calcium to fight off osteoporosis, the thinning of bones. But on the other side, some older studies started raising these red flags. The thinking was that maybe excess calcium could mess with your blood vessels, which of course is a risk factor for dementia. So, what are you supposed to do?
Well, luckily for us, a new study decided to take a fresh look at all the data. The goal was to finally bring some much-needed clarity to this whole debate.
And here it is, the headline finding, straight from the researchers who did the work. They found no sign that taking calcium supplements at the levels people typically use for bone health had any impact on dementia risk. That is a very reassuring conclusion. So let's break down how they got there.
Okay, to really understand this verdict, we need to look under the hood, right? Let's dig into how the study was actually put together.
So the researchers used this really clever method called a post-hoc analysis. What that means is they basically took the data from an older, really high-quality study and looked at it with fresh eyes. The original study was actually about bone fractures, not dementia, which gave them this powerful, unbiased data set to work with.
And get this wasn't just a quick look. The original trial ran for a full 5 years, but the researchers were able to keep tracking the participants' health records for a total of nearly 15 years. That kind of long-term view is absolutely crucial when you're studying a condition like dementia that takes a long time to develop.
Now, who were they looking at? The study focused on a very specific group, 1,460 women from Western Australia. All of them were over the age of 70, and none of them had dementia when the study first started. The setup itself was a classic randomized controlled trial, really the gold standard for this kind of thing. About half the women took a daily 1,200 milligram calcium supplement, the other half took a placebo, just a dummy pill. Comparing these two groups is the best way to figure out if an intervention actually has an effect. So, after all that, what did they actually find? And just as importantly, what are the caveats, the things we need to keep in the back of our minds? The main result was pretty remarkable. When the researchers looked at dementia events, which they defined as either a hospitalization or death related to dementia, the outcomes were practically identical for both groups. The women taking calcium had no higher risk than the women taking the placebo. No difference at all. But, and this is a really big but, science is all about context. It's so important to understand the study's limitations. First off, the participants were a very specific bunch. Older, white women who were pretty well off. So we can't just assume these results apply to men or to people from other backgrounds. Second, since they were reanalyzing an old study, they had to rely on hospital records for dementia diagnoses, which might not catch every single case. The original study also wasn't designed to test cognitive health in superfine detail.
Okay, so we've got the good news and we've got the fine print. What does all of this actually mean for you, practically speaking?
Well, let's hear from an expert who wasn't involved in the study, Dr. Giulio Taglialatella. He called the findings very significant. He suggests that for women who are at risk for osteoporosis, they can probably be treated with calcium safely without having to worry about that increased dementia risk. That's a pretty powerful statement.
And finally, here is probably the most important piece of advice of all, this one from the Alzheimer's Association. While this study is definitely reassuring, it is not a green light for everyone to just start popping calcium pills. Your health is totally unique to you. So before you start or stop any supplement, the first and most important step is always to have a conversation with your doctor.
This new verdict on calcium is a great reminder that science is always moving, always evolving. And it leaves us with one final, fascinating question to think about. What other piece of common health wisdom, something we've believed for years, might new research completely turn on its head next?